And our idea with Y Insights was to create a virtual series, bringing in leaders from New York City and around the country to discuss some of the critical issues of the day. And there are many of them in this country that we are all facing. But I know top of mind for almost all of us, if not all of us, is the pandemic, which is why we are so fortunate to have Dr. Wayne Riley join us this morning. And you do, I think, have his extensive bio, but I want to give you a few highlights. He is the president of the State University of New York, SUNY Downstate Health Sciences University, which is the only academic medical center serving Brooklyn. He has held many prestigious positions, including president and CEO of Meharry Medical College and president of the American College of Physicians. He has a BA from Yale, an MPH from Tulane University, an MBA from Rice University, and an MD degree from Morehouse. And I stand in awe of that alone, of the academic fortitude that you have. And he was recently named chair of the New York Academy of Medicine. And most important for me, he has been an essential YMCA Greater New York board member and great champion and incredible advisor. So welcome and thank you for being here. I have a number of questions for you and a few from some of those who sent in. And for those of you who are on the call, you may also use the chat function. So take a look at that and we can refer to that as well. And I've tried to divide my questions into three categories. The first really focus on COVID. The second are about healthcare more broadly. And the third might be a little personal. So hopefully that'll give you a sense of where we're going. So let's start with some of the COVID related questions. And I know we're all reading and hearing a lot about a resurgence. And I want to start with how you're feeling overall about where we are as a city and a country and what we should be prepared for.
Well, great. Good morning, Sharon, and a special good morning to our donors and champions of the YMCA of Greater New York. One thing Sharon and I talk about is the opportunity that we get to serve others in our careers. And I see my role as a member of the board of this great organization as contributing to the betterment of New York and New York City and the young people and the seniors and everybody in New York City because of the storied role that the YMCA has played in Greater New York. So I'm very proud to be a board member and of course very proud to be with all of you this morning. I will tell you, my day was long yesterday. It was consumed by vaccine discussions, and I'll talk about that shortly. Matter of fact, at 8 o'clock last night, I was on a call with the FDA commissioner, Dr. Han, and we had a lengthy hour-and-a-half discussion about the vaccines and its distribution and so forth. So I'll be happy to take.
Yeah, that's one of my questions too.
A lot of questions, but let's go back to where we are now. And unfortunately, I often fear the period between Columbus Day and basically Super Bowl weekend as being a high likelihood that we would have a surge, a second surge. And this is not too inconsistent, by the way, with the Spanish flu. But remember, the Spanish flu is 1918, and we have much more robust public health practices, measures, tools, technology that you would hope that we would not have repeated the history of the Spanish flu, but here we are. And I think many of you watch Dr. Fauci, as I do. We are now having a surge upon a surge. The spread now is very different than what it was back in the spring, where the spread was community spread because we didn't know where the virus was in the community. But now the spread is principally driven by human behavior. Small gatherings. We know in New York, there's been some well-publicized social gatherings in various parts of New York City, Queens, Brooklyn, et cetera, that have contributed to what we refer to in public health as super spreader events or mini super spreader events. And we just had Thanksgiving, and again, we're bracing ourselves for about 7 to 10 days. We will start to see an uptick because we know that people did not necessarily fully heed the advice we were giving to not congregate, in large settings over Thanksgiving, that this was going to be a Thanksgiving unlike any other. By the way, this will be a Hanukkah and Christmas season unlike any other we've had. And so, we are seeing a surge. Now, again, many of you have relatives all across the country, and I know you've talked to them. The upper Midwest is particularly hard hit. You know, the South, at first it was the Northeast and the South. I'm a Southerner, I'm from New Orleans. New Orleans got hit fairly early in the epidemic and has stabled off, but now it's migrated up to the West. And of course, California is now back where they almost were back in the spring. The good news so far in New York is we've seen some glimmers of good news, and I think you've seen this in the reversal of the mayor to now open public schools for elementary and middle.
Right.
There's been very low percentage of positivity among school children, Sharon, which is very pleasantly surprising. But again, you know, the biggest risk that we have in the present and over the next, I'd say, month and a half is social gatherings. That we're just frustrated with how long this is going on. When will this ever end?
Right.
You know, I want to see my grandparents. I want to see my relatives. You know, and so the super spreader events are really going to be very potentially taxing to the healthcare system. Now, we have the bed capacity in New York. That's not the problem. It is the healthcare workers who are just exhausted.
Yeah.
The nurses, the respiratory therapists, and you know, a lot of people don't realize how labor intensive healthcare is. You know, there's not technology, you know, to do certain things of patient care that we know people have to do, as in nurses, et cetera. So unfortunately, we are, you know, back to where we feared we'd be.
Can I, on your healthcare question, because you and your team at SUNY Downstate have been on the front lines of COVID care. And I think one of the questions is, how can New Yorkers best support frontline healthcare workers at this moment in time, given the fatigue, given what we know might be a resurgence? Are there specific things we can do to best support you and your teams?
Well, quite honestly, the best thing you can do is not try to become a patient right now. And that
Yeah.
goes back to, you know, hey, social distancing, hand washing,
Right.
the mask wearing, to the extent that you cannot be a burden to the healthcare system as a New
Yeah.
Yorker right now, really helps other healthcare workers, by the way.
Yeah.
Uh, you know, there's one hospital in town that has, you know, over 100 of their staff who are out either under quarantine or positive. So you could see that, you know, if we could, flatten the curve again, as the governor said back in the spring, to lower the amount of cases going into hospitals, that is the best medicine, quote unquote, that our healthcare workers need right now, is
Right.
for folks to not get sick, not get COVID, not come to the hospital, not
Yeah.
need ICU care, not need ventilator care, et cetera. So it's very simple. They don't need, sure, they don't need money, they don't need food, they don't need PPE. We have enough of that. They just need New Yorkers to heed the advice of the governor, the mayor, somebody like me, Dr. Zucker, the public health community, because that's the best thing we can do right now to protect our healthcare workers.
Yeah. One of the participants on the call had actually asked a question saying, what would you consider are the most important safety protocols to focus on and reinforce for those who might have some pandemic fatigue? And maybe it's exactly what you just said, but if there's 2 or 3 things, what are those things?
Well, what
it's the mask wearing.
Right. Yeah. And let me tell you, at the beginning of the pandemic, you remember how you were getting the messages about touching surfaces, and well, we now know, yeah, you can get COVID from touching surfaces, but it really get COVID from respiratory droplets. And that's again, where being in proximity to someone who may have COVID, as we speak, we admit respiratory droplets. And so you say, okay, what do I need to do? Well, obviously don't put yourself in a situation where there's a whole bunch of people. I've learned more about ventilation systems as you have, Sharon.
Yes.
For the last 6 months, my engineers have come in and taught me about MERV and HEPA, and why MERV filters and HEPA filters are able to filter out the virus. So no, I'm being funny, but ventilation in your homes, your apartments, your condos, your townhouses is critically important. So make sure that if you can get the best high quality filters. Something we used to tell our folks at Downstate not to do during the winter. We used to tell them, don't open the windows because it'll dissipate the heat. Now we're telling them, open the windows to let ventilation in, because one thing about the virus, it's a very deadly virus, but it's very delicate. That airflow sort of knocks it apart and it falls to the ground. So that's the number one thing in your homes over the holidays. Don't have the windows all sealed up. You don't want to be hermetically sealed right now. Yes, you want to warm your house, but you want to open one or two windows in various parts of the house so you get a little airflow. So that's, because of the respiratory droplet thing. And, that's part, I don't want to be political, but that's also part of the rationale that the governor has put out in terms of mass gatherings, because when you're in an enclosed space, you can't ventilate in an enclosed space very well. And I know many of us miss going to synagogue, miss going to church, but those are setups for just the respiratory droplet transmission of the virus. So, like mask wearing is that we are firmer now in December on mask wearing than we were in March. In March, it was kind of like, oh, maybe it's a good thing to do. No, we know it's a very good thing to do. It's been studied by textile engineers, biomedical engineers all over the world that mask wearing decreases the likelihood that you will either transmit the virus, and even newer data put out that you could get the virus. So mask wearing, ventilation, staying away from crowds are the three biggest things we can do to protect each and every one of us.
That's great advice. Now, can we go back to the vaccine piece that you mentioned? And if you have a little more insight about when they'll be available, how they'll be distributed, how will we get people to participate in the vaccination process?
Well, let me tell you, as a physician, I am just stunned at how good the data look on at least three of these vaccines. And physicians are very skeptical. Sharon is the daughter of a great physician, Dr. Norton Greenberger, who was a fantastic, one of my predecessors as president of the American College of Physicians. So I know she was raised in a house with a doc. Physicians tend to be skeptical of new drugs. There was an old saying that a physician should never be the first to prescribe a new drug, nor the last. But in this case, the data are so strong. And like I said, I was on a call with the FDA commissioner last night, Dr. Stephen Hahn. It was an hour and a half with about 100 of us healthcare leaders around the country. And they meticulously went through the data. And ladies and gentlemen, I tell you, I'm stunned at how good the data is. Now, what that means for you is, what do you mean by that, Riley? Well, it means that the protection afforded by these two vaccines, whether it's the Moderna or Pfizer, is you may hear it's 94% efficacious or it's effective. That is almost unheard of, because even the best flu shot, we always hope for about 60% efficacy. So the fact that they've gotten these vaccines to almost 95% efficacy is just stunning. It's a stunning scientific achievement that I think we should be proud of as a nation. And remember, this is the taxpayers at work here by your tax support of the National Institutes of Health and other healthcare facilities, research around the country. This is the benefit we get as taxpayers, that we funded a lot of the research and technology that now has led to what we think will be two great vaccines. So number one, the vaccines we think are very safe. The other good news is they work very well in 65 and older, because that was our other fear, that maybe we'd get an effective vaccine, but it won't really work well in seniors. Well, both of these vaccines work very well in seniors. So that's the other part of this. Now, you've heard about the cold chain supply. Yeah, the cold chain supply, and what that means is that one of the vaccines, the Moderna, has to be super cold, minus 80. And, I don't know of many homes in the country that have minus 80-degree freezers. I know mine doesn't, but our hospital does. And that's where the minus 80 comes from. Hospitals tend to have the super cold, refrigerators. So, that will be taken care of. Your hospitals will take care of it. Now, will you be able to get it in your doctor's office? No, not yet. Not yet, because of how complicated it is. And there will be a triage system. Healthcare workers will be first in line, we think. We're waiting for the committee to vote today. The final word is this advisory committee to the CDC on immunizations that will make the pecking order, if you will, of who gets the vaccine. So I suspect that it'll be healthcare workers. Number two, it'll be patients who are in long-term care facilities, nursing homes, rehab centers, et cetera, because we know here in New York, we know nursing homes have been just ravaged by COVID. So getting vaccines get into the arms of as many nursing home residents will be a great thing to stem the tide as well. And then it'll go to teachers, et cetera, et cetera. So the good news is, per Dr. Hahn last night in the FDA, his prognostication is by May, June, every American who wants one of these vaccines will by then have had a chance to get it.
So it's about a 6 to 7 month distribution
7 months,
chain.
right. Exactly.
Right.
So we've got to get through the winter where people are more inside. We'll hopefully get to the spring where we start to get more outdoors and less cooped up. And by then, we should start seeing heavy penetration of the vaccine. The other thing about the vaccines, there'll be surveillance after. So people say, well, yeah, this is an emergency use authorization, which is sort of a fast track process, but it's still data-driven fast tracking. It's not Dr. Hahn saying, oh, I think it's time to just offer this vaccine. No, it's going through a rigorous review. They had to submit 10,000 pages of documents, ladies and gentlemen, 10,000 pages of documentation to the FDA just with the application. So there's lots of data. They've looked at the subsets. They looked at everything. So I want to assure you that I will be one of the first physicians who will volunteer to take this, one or both of these, because I believe they're safe. And I believe the risk reward is significantly in favor of reward for taking this vaccine. And again, I'll take more questions about vaccines, but I think that is one of the best news stories going into 2021, is that we're going to have at least 2, possibly 4 by the spring, very good, safe vaccines.
Which is super encouraging. One question though that I think is top of mind for folks is 6 to 7 months on the one hand is a reasonable time frame to sort of get your head around. On the other hand, how do we protect ourselves against the angst and the fatigue and the isolation that we're all facing right now? What is your advice for helping us get through those next 6 to 7 months until we can see the light at the end of the tunnel?
Yeah, I have to give the bitter pill here. There's no, rocket science to this. The good news is we have, 2 or 3 great vaccines coming down the pike. The bad news, it's just going to take a little time to get them into everybody's arm. So in the meantime, we have to do what we just spoke of, Sharon. We have to avoid, mass gatherings. And if you think about the cultural life of New York, I've been in New York almost 4 years now, and the heartbeat of the city is our cultural, stuff that we do. It's not being able to go to the great, Dodge dinner that we put on. It's not being able to go to the Met, or in my case, I'm a jazz lover. I like to go to jazz at Lincoln Center, or the Mets game, or the Yankees game, or the Knicks, or the Nets, or the opera and the symphony in Carnegie Hall, et cetera. So, but that's what's on the other side of this, ladies and gentlemen. Once we get enough penetration of vaccine, we can start doing those things that we love as New Yorkers. So again, I think we will have a much better summer than we had this year in 2021.
That's something to look forward to. You were very instrumental in helping us develop the protocols to restart and reopen our facilities for use. And I know we've had a couple questions around the confidence in coming into fitness facilities. We have a question in the chat about pool use and the importance of exercise and how to balance some of the things that we're seeing. And can you comment on that and what we've done and how people should be thinking about using our facilities?
Yes. So again, I got to salute Sharon and her team. She has reached out to not just me as one quote unquote medical expert, but medical experts at the New York City Department of Health, New York State. And I think we've all sort of rolled up our sleeve and given the best guidance we can. I was in favor of reopening the gyms because I thought if done properly, it could be reasonably safe. There's no 100% with a virus, right? But again, the protocols in terms of decreasing the density, spacing out the equipment, particularly in the fitness centers and weight rooms, limiting capacity, the ventilation systems. I know Sharon, you and your team have done great work on the ventilation system at the branches and Y facilities. And again, the data suggests, I just sent Sharon a report that there has been in most states very little transmission of gyms that have followed. and fitness centers that have followed the guidelines. So I think that's good. Now, in terms of swimming, swimming is, as you know, an excellent aerobic exercise. Uh, I fully encourage it. I think it's safe. Chlorine probably does have some bactericidal effect. But again, it's the same concept that if you swim, there shouldn't be 100 people in the pool. It should be decreased density. There should be still social distancing in the pool, et cetera.
Which we are doing.
So again, I think, we've calibrated it just right. There's certain activities we've had to discontinue, right, Sharon?
Yes, we're not allowed to do any group exercise, but all the other things, you're right.
Right, no Zumba, no, group fitness classes, which I know many of us love and miss.
Yeah.
But again, part of the psychology of getting the gyms open, I know the governor knew this, is people were just, at wit's end. They couldn't go to the gym, they couldn't swim. He had to, he always talks about the dial, that you dial, you tighten up things and then you release. Well, he knew he had to release as we got into the warmer months of the spring, because people were really, really pent up, and you want to invite compliance by, relaxing certain restrictions, which he did. And the why, it was onerous on the why. We, Sharon will tell you, donors, we were on the call, the board yesterday, we've lost membership. Part of it is economic, people having job instability. Some people have left New York City temporarily, hopefully not permanently. So we're going to need an all hands on deck approach from, the staff, the board, and our donors and champions to get people to come back to the Y once we can go back to what I refer to as the new normal. So all in all, I think we've done a tremendous job there. And Sharon will tell you, there's been no major outbreaks of any facility that we've been aware of.
Right.
Which speaks to the fact that the protocols are working.
Thank you. Yes, and thank you for your assistance there. One last question on the pandemic, and that is really about what are the key lessons that we've learned over the last 8-9 months that we'll use going forward, certainly to prevent something like this from happening again, but what are the permanent lessons that we'll now incorporate into our behavior and care?
Well, as a healthcare professional and a leader of a health enterprise, I think one of the things that we all talk about with all the hospital leadership around the city is that, look, New York has, when we've thought about disaster planning, we've always thought about, because of where we are, terrorism, bioterrorism, natural disasters, superstorm Sandy type events, mass shootings. We hadn't really, gotten to the chapter about pandemics. But that chapter is going to move further up in the playbook now, ladies and gentlemen, because if you look at the history over the last 30, 40 years, it looks like every 10 years or so, there is some sort of global pandemic. And so I think we now know the preparedness level for global pandemics has to be sort of a daily, weekly, monthly, yearly thing from now on. And again, if you had told me last year at this time that within 2 months we would be beginning to lock down parts of New York City and the country because of a pandemic, I would have thought, you must have seen that movie Pandemic, you're dreaming or something. So this was not that high on our radar. We dealt with Ebola, but that was sort of isolated, and that was we dealt with SARS, that was isolated again, but nothing on this scale. So I think one of the first things as health systems is we have to be prepared. Now, as individuals, I think, this pandemic has really highlighted the fact, look, one of the great gifts of life is life itself. And I think if you've lost a loved one or had a loved one who's been sick, or you've had a friend that you've had to console and help get through this, or you've had a friend or relative in a hospital, you couldn't visit them. This underscores, how, we cannot take our health for granted. And particularly in New York City, among Black and brown communities that have been ravaged. And, Sharon just mentioned, I'm new chairman of the board of New York Academy of Medicine. And we want to be very muscular about raising the issue of health disparities, that many of the people who succumbed to this disease early in the epidemic were Black and brown, who wait on us at Starbucks and the dry cleaners and, and the nail shop and the barber shop and sometimes cleaner houses and apartments that conduct the subway, that are our livery drivers. These are the people that got hammered first. And so we have to pay attention, to those New Yorkers, because look, the economic vitality of New York depends upon Black and brown labor and their contributions to the labor market here and their membership in the Y and their family's ability to enjoy the programs at the Y that many of you support so dearly, and we thank you. So I think that's the two big learnings as we learned that pandemics are here to stay. And number two, that we as individuals have to take our health more seriously, and we have to take the health of vulnerable populations more seriously.
Yes, you have been a great champion of improving health outcomes for communities of color, and I've seen you discuss this on CNN, and I know this was a question that came in around what do you think some of the root causes are, and what can we do to address some of those disparities?
Well, this health disparities is is a complicated construct, Sharon. It in part it relates, at least for African Americans, from the fact that look, from the point that our predecessors were brought here from the continent as slaves. Slaves had lousy health care. They had high rates of disease. Many slaves died in transit because of communicable diseases. And, ever since the United States government has been tracking, all the health statistics, African Americans and Latinos have never had the level of quality metrics that non-Black and brown Americans have had. So we're starting, almost 200 to 300 years behind. Number one. Number two, part of it is socioeconomic, as you know. If you did not tend to go to college or did not go to high school, your quality of life is different. In some respects, your nutrition is different. Your education is different, obviously. And so it gets into what we call the social determinants of health. And that's just the term for saying poverty, education, employment, access to good food, access to, safe housing, effective housing, et cetera, is a major contributor to our health. And then you overlay the genetic component of diabetes, hypertension, obesity that again tend to be in higher proportions in Black and brown communities. You can see how the perfect storm came together here. We've got the pandemic, we've got the social determinants of health, and we've got healthcare disparities. And so that's how you should think about it as sort of a multifaceted reason why this happens. And again, this is something, again, as a country, as a nation, we have to focus on because if you think about that, almost 40% of your population may be subject to pre-existing conditions. Right. That's not good for the national security of the country. That's not good for the economic vitality of our economy on the world stage, et cetera. So this is serious in terms of the way we look at health and healthcare.
It's so true. I'm wondering how you think about how we can change the economics to better support preventive care over sick care. And I have to ask, what's the role the Y can play? It's obvious, but what's the role the Y can play to support that? But this sort of changing both the structure and the economics to really focus on those underlying conditions and preventive care. How would you go about doing that?
Right. Well, let's start with the Y. Look, the Y is all about health and wellness, ladies and gentlemen. And Sharon and I had a conversation that this is our business. It's health and wellness and health and wellness. And to the extent that you describe health as your morning swim, as one of our donors and champions just mentioned, she misses her morning swim or she's gone back to a morning swim. That's part of a healthy lifestyle. That's what the Y is about. Wellness, teaching kids to swim so that they don't drown, is a wellness thing, is a health thing. Having senior citizens programs where seniors can get out of their house and have the social stimulation of visiting with others and activities is good for wellness. So this is our value proposition, as they say in business school, is health and wellness. And so donors don't think that your support doesn't make a difference to the health and wellness of New Yorkers. It does, because if there is or was no Y, I think things would be worse. would be worse. We don't even want to fathom that. And then going to the first part of the question in terms of, the economics, we've got to have a vigorous discussion about education, housing, and having a livable wage in New York City. New York City it's a great place to live, but it's a tough place to live, particularly if you're on, tougher economic circumstances. And so we have to understand that about our fellow New Yorkers, and hopefully come to some set of policy prescriptions, if you will, that help them to live better, to have a livable wage, housing, better education for themselves and their families, et cetera. Because in the end, we know that almost a linear relationship between if you have all those things and you don't have all those things in terms of your health. And you have a job, you have health insurance, you have a livable wage, you can avail yourself of certain things in this city that make a difference in all of our lives.
Yeah, and you're exactly right. I think I like to say the why created preventive health. We don't always lean into that history, but that's exactly what we were about, and it's what we'll continue to really focus on.
Correct.
And one of the other questions that came in was, what are your thoughts on a single payer system, practically and politically?
Well, the brainy academic in me, and as Sharon told you at the beginning, I love school. If I could go to school all my life, I would have. I thought about going back for a law degree, but my wife said, that's it, that's enough.
Gotta stop somewhere.
She said, you got to go to work. But, you have to think about it in terms of that. It's important. And, where we go, going forward is up to all of us, basically, and to great organizations like this. I tend to look at this as maybe a more simple syllogism than people sometimes think through. But it's up to us to sort of embrace, where we need to go with this.
And can you talk a little bit more about the impact of the pandemic on the city's health systems? And I know this ties to your work at the New York Academy of Medicine, but what are some of the key lessons learned there? What does the city need to do to prioritize going forward to help institutions like yours and communities across all 5 boroughs?
Well, one of the things, and Sharon used to work at New York Presbyterian, and so I know healthcare not only because you're a daughter of a physician, but you worked in healthcare before we were.
You know my bio better than anybody else. I'm so impressed.
Before you came to us, we knew what you were doing, and thank God you came to us because you're doing a terrific job. But healthcare is very competitive in New York City. And I think one of the things, because I remember the governor had all of us in a room at the Javits Center early in the pandemic, and our friends from all the Manhattan, great places that many of our donors support as well. And, he said, look, doctors, and leaders, yeah, I know you guys compete against each other, on a daily basis, but this is no time for competition. We need everybody to work together. So I think one of the residues of this is that we did work well together. In spite of the fact that I run a safety net hospital in Brooklyn, we had great support from some of our friends in Manhattan. And again, during the heat of the pandemic, I will tell you, ladies and gentlemen, I got a call at Friday night about 10 o'clock from a hospital in Brooklyn. I'll keep anonymous, but the CEO called me. He said, look, Wayne, I'm about to run out of oxygen. Can you send me, oxygen? We're down to our 2 last big canisters of oxygen. We have all these patients on a ventilator. I said, I will send you, I think I sent her in the middle of the night, 50 of those things. And she was eternally grateful, and she repaid me back when her shipment came in. So I think one of the great residues of this is that although we're very competitive here, all the health systems, we work very well together. We rolled up our sleeves, we collaborated. So I think that's one of the good news stories of this. Now, can we keep that going?
Yeah,
will be the challenge, because if we revert back to our hyper competitive ways, which I fear we probably will, that won't make it easier for us to be ready for the next pandemic that we always have to be prepared for, as I said just earlier.
that's great. And I want to congratulate you on your recent appointment as chair of the New York Academy of Medicine. That's great. And I wonder, you talked a little bit about this. Can you talk a little more specifically about what some of the goals you hope to accomplish during your time as chair and what you'll focus on and what that might mean for the city and the state?
Great. Well, thank you. I was very honored that the Board of Trustees of the New York Academy of Medicine asked me to assume the chairmanship, which I did last month. New York Academy of Medicine is 170 years old. It has a beautiful building right there on Park Avenue. And it has been focused over its many years. It was really founded also because of a time similar to this, where the communicable diseases, tuberculosis, and so forth were ravaging, New York City. And folks got together and said, look, we have to, figure out a way to get the city healthier and to let doctors lead this and people with scientific background. And that was the genesis of the New York Academy of Medicine. And then over that 170 years, it's been involved in various things, improving care in New York City, pediatrics, surgery. It's been very focused on what I call the specialties. And then over the past, I'd say 10 years, it started to pivot more towards the health of New York City. It's not just, having great surgeons, great internists, great pediatricians, which I think was part of its focus, for well over 100 years. It pivoted to, hey, we have to think about the population health of New York City and why certain communities have worse outcomes, just like what we said before in terms of health disparities. So my goal is to sort of turbocharge that, catalyze more work with kindred organizations who believe in that as well. I think we need to be more muscular in some of our policy pronouncements. For example, vaccines. We've had a long discussion about vaccine. My theory is that we should be very muscular and assertive in saying, look, if there is a good, safe, effective vaccine that can protect a New Yorker, whether you live in Bronx or Upper West Side of Manhattan, you should get it. And so I'm going to try to position the New York Academy of Medicine to have a more presence in some of those discussions that we know we're going to be having over the next few years.
That's great. It's interesting. There's been a lot of questions around sort of what can be encouraged and what can be mandated, whether it's around vaccinations, whether it's around a national lockdown. And how do you think about balancing those things? And how do you, one, how do you balance those? And two, what more can we do on the education and encouragement so that we don't get to a mandate?
Yeah, this gets to, the vaccine hesitancy thing that we have in certain parts of the country and certain parts of New York and certain neighborhoods in New York. The reality of this too is, if you think about it, there are going to be sort of mandates for you to be vaccinated for certain occupations. It is highly unlikely that a young man or young woman from the Bronx who volunteers to serve our nation in the military will be able to refuse a COVID vaccine if they want to go in the Army, Navy, Air Force, or whatever. I would suspect that many employers, particularly if they're service industries, may say, look, if you want to work here, you have to have the vaccine. And my lawyers tell me at Downstate that labor law dictates that you can mandate for the health and safety of employees certain vaccines, et cetera. College campuses have the authority to bar people from enrolling if they don't have all their shots. So again, I think the reality will deal with some of this, but the more concerning part is what I call the anti-science climate. And unfortunately, a lot of this has emanated from Washington over the last 4 years. It is very distressing to us who have dedicated our lives to patient care and leading institutions to take care of patients and educate healthcare professionals. The sophistry, if you will, that has come out of Washington about science. And this is incredibly damaging to our republic. That science matters to the health of New Yorkers and to the health of the nation. And to the extent that we can, rebut that and get people to disabuse themselves of some of these falsehoods around science. And For example, Dr. Hahn told us last night on the call that he was talking with a group of fairly educated people about the vaccine who were telling him, oh, I'm not going to get the vaccine because we hear that there's going to be tiny bots in the vaccine that once it goes into our arms will then, and he said, doctors, this was an educated group of people and they believe in bots in vaccines. So that's part, again, a manifestation of this anti-science climate that we have to deal with. And I trust that that again, the Y can play a role in that by educating around health and wellness, that being healthy means having all your shots, whether you're a senior who needs a shingle shot or a flu shot every year, or your child needs, DPT, or you need a tetanus shot because you stepped on a nail, or got your finger, hooked on a fish hook, while you're fly fishing. These are the types of things we have to make sure people understand, that vaccines have been part of our life in America, for 100 years, and they've saved lives. They've saved more lives than any CAT scanner, any surgeon, any drug. Is vaccines, pound for pound, have saved more lives worldwide than anything probably we've done in medical science.
And we need to tell that story. And it needs to come through, I think you're right, trusted brands, right? Because that's what people refer to. And I think the Y has a role there. I'm curious, as you think about the political change on the horizon, and you've mentioned a sort of return to science or a resurgence of science that you hope to see, are there other things that you think might come, either from a Biden administration, a shift in mentality around science and medicine, and what should we be paying attention to?
Well, I have had some discussions with some of the Biden transition folks. They reached out to me for advice on certain things, and I was, very happy to provide it. What we want in health and medicine is, again, a return to the normal order, if you will, that there's transparency about major health issues facing the country, that it's better to hear from a Tony Fauci on a daily basis than a political figure. I've known Dr. Fauci for 20 years. He's a native New Yorker, Brooklyn, Weill Cornell.
You can hear the accent.
You can hear it. Tony is very proud of his Brooklyn roots. His father was a pharmacist. The great story in New York Times, the Fauci Pharmacy in Brooklyn. But we need to hear from the Tony Fauci's going forward. And I think the president and his team understand that they know that the political figures have to get out of the way and let the doctors and the scientists lead this, this effort. And I think you're going to see that in terms of what I understand, the way he's going to stand up the administration. There's some discussion about appointing a COVID czar who will sort of be the day-to-day face of the addressing the pandemic in the spring. Which I think is a great idea, because HHS, FDA are busy with lots of other things. So having that kind of czar or czarina, I think, will be very good. And I think you'll see the president and the vice president-elect, the president-elect and vice president-elect, sort of let the professionals do this, and they'll come in with a messaging, which I think is the proper way to do this, which unfortunately I don't think we've seen over the last 4 years, by the way.
Yeah, it'll be a different tone, I think. And a personal question for you, which is, this has, I'm sure, been a very trying time for you. What are you doing to stay strong and to keep your mental focus and to keep your teams going?
Well, you're right. This has been a very stressful, 9 months. I was joking over Thanksgiving as we went around the table before we ate our Thanksgiving meal. I asked my two daughters and my wife, we need to say we're thankful for, and we thank for each other and in life and our friends, and we prayed for all the great healthcare workers who've lost their lives and have been sickened. And I said, I'm very thankful that 2020 is coming to an end.
Yes. We're going to have to do a collective toast. Adios.
This is going to be a heck of a toast on New Year's Eve. But, in terms of my personal, it's a very stressful time, very stressful job. I got 4,000 employees, 2,000 students, a big enterprise, $1 billion budget, lots of complications. And you try to, I try to take, the long view. I try to take care of myself. I like to get out and walk. I used to run, but the knees got a little too, a little too stiff at a certain age. So I'm an inveterate walker. Sometimes I'll walk from North Brooklyn all the way into Manhattan. I love it. I'll go over the bridge and, I just love to walk. So again, exercise is important. So many of our colleagues and donors get their exercise at the Y. I am a member of the Y, and I miss going to the track over there. So once that we can go back into that and do that, I will. But you have to take care of yourself doing these things and find little enjoyments, whether it's reading, exercising, because we don't have the social outlets that we used to. New Yorkers are creature habits. We're used to playing bridge with our group on Tuesdays and poker on Saturdays, or the golf, or the tennis group, or the yoga. We're used to that. Well, again, that's what we've had to sacrifice. So you have to have some proxies for that. Technology's helped. So whatever you can do to confect your new normal, as I say, and just embrace the fact that we all have to adjust to a new normal. We will get close to where we were before. For example, I think it's highly likely that mask wearing will be very common in the United States, maybe from now on. For those of you who've ever been to Japan or China, the Chinese and Japanese, I've been in Tokyo, you're walking down a beautiful street in Tokyo, a lot of people wear a mask. I thought it was silly when I was there 2 years ago, but now I don't think it's that silly. They've been onto something a long time. So there's going to be some changes in life and this is what I say is the new normal. Let's not be too nostalgic for what we recall as the normal, and embrace the new normal. And that's also resetting our expectations and lowering our stress about this, is understanding that we have to adjust to a new normal as New Yorkers and Americans.
Right. And you mentioned, I did not realize it's been 4 years since you've been at SUNY Downstate, and I just want to.
April will be my 4th year anniversary. How time flies.
So congratulations. And I know SUNY Downstate, I have read some, you educate more medical professionals than any other institution in the state, that more of your folks actually stay in New York and serve in other hospitals. And you've been there almost 4 years, and I'm just curious, what were some of your greatest learnings? How are you thinking about the future of SUNY Downstate? What are you excited about once we get past mid 2021? What's your vision of the future there?
Well, great. SUNY Downstate is a storied, academic medical center in the Flatbush part of Brooklyn. And, if you trace back our roots, a lot of our early students were the children of Eastern European Jewish immigrants to the United States, who unfortunately could not get into medical school in certain other parts of the region due to the Jewish quota. And so Downstate has that wonderful heritage of having accepted and embraced, a diverse student body. And here we are in 2020 still doing the same thing, even though our neighborhood has changed in terms of demographics. Yeah. The core principle of which this place was founded remains. The quality of our people is just outstanding. I'm still blown away at how good our surgeons are, good our doctors, our nurses, and they've not gotten a whole lot of recognition. And again, that was, quite frankly, part of my strategy during COVID, is to elevate our profile in terms of the great work we do. We can't do much better. We had a front page story on April 16th, above the fold. New York Times talked about our great work. We had a primetime CNN special. I've been on CNN and MSNBC, talking about it to make sure they see experts from downstate talking about this. So we've done a lot intentionally, to elevate our profile. But this is a great institution. As Sharon said, we have the largest medical school by enrollment in all of New York City. We admit about 210 medical students every year. And that's very high. We're the 15th largest medical school in the country. There's about 160 medical schools around the country. 48% of the doctors who will graduate in May will stay in New York City or New York State for their residency. 70% of those will remain in New York State or city to practice and raise their family and be your doctors and your children's doctors and your grandchildren's doctors. So we are very proud of what we do to contribute to New York City and New York State. And one of my goals since coming here is to make sure that the governor and the legislature and the elected officials know this about us. And I think we now have done a better job of highlighting the great work we do. It is a wonderful institution. You know, we had a Nobel Prize. The first Nobel Prize in the whole SUNY system was done at Downstate. Dr. Bob Firschgott got the first Nobel Prize back in 1993. So this is a great organization. I'm honored every day. And as I tell the medical students, I can't wait to get to work every day.
That's great. Well, you really are building the infrastructure for the city and the state, and we thank you for that. And I'm going to go back to the chat, and I'm going to encourage anybody who has additional questions. We have a couple more minutes. I see one from your great friend. I thought I saw it here from Jack Rowe around any comments about the future of nursing homes.
Oh, excellent. Well, Dr. Jack Rowe, one of my mentors and dear friends, the former head of Mount Sinai, former head of Aetna, we served on a corporate board together up until recently. And Jack has been one of my handlers since I moved to New York. And the reason why I joined this board was—
He brought you to it, yes.
And Jack, thank you so much. I hope you and Valerie and the grandkids are well. Nursing homes, and again, you know, Dr. Rowe is a world-renowned geriatrician and expert in medical care of aging populations. You know, the nursing home model has to be relooked at in light of this. And I think Jack would agree with this, that, you know, one of the saddest chapters of this whole, you know, epic is the fact that nursing homes were woefully underprepared, understaffed to deal with COVID, worse than healthcare facilities. And, you know, we have to rethink, you know, nursing home care. You know, I got to tell you, just this week, Jack, my mother broke her hip down in New Orleans, and she's in rehab today. And the conversation with my sister, who's a nurse, was we got to get her out of rehab because I don't want her to get COVID. But these are the real life conversations that families have about nursing homes and long-term care facilities that, again, we're going to have to relook at this model, you know, and the staffing and the quality of staffing. And remember, many of the staff who are in the nursing homes that take care of our seniors and our loved ones are those Black and brown, you know, members of New York City community that have the social determinants, that have had constricted educational opportunities, that live in more inferior housing or are more housing unstable. So again, you know, this moment begs that we have a better look at how we do nursing home care. And like, you know, Jack's been a big proponent of in-home care to the extent that is possible. And, you know, I think during this time, many of us would prefer to have our loved one in home, but that comes with a lot of logistical challenges, Sharon, as you know, when people are infirm or under palliative care, it can be quite difficult on families. So there is a role for nursing homes and so forth, but we have to relook at the model, the staffing model, the financing model of nursing homes and their level of preparedness for pandemics or disasters, which I think we now know was woefully insufficient in some respects.
And there's another question that came in: how do we increase primary care reach and investment?
Well, again, Dr. Rowe and I have talked about this too. He and I are very concerned about the fact that you know, primary care is a comparatively less attractive career for young physicians. First of all, it doesn't pay as well, and we've got to fix the pay inequity. And again, you know, medical students are very smart. They've sacrificed a lot. Some of them have a lot of debt, over $200,000-300,000 in debt. So even though their heart may be pulling them towards pediatrics, you know, their financial considerations may pull them the other way towards something that pays more. And that's not what we want. And I tell medical students all the time, do not do anything for the money. You will be miserable, you know, ologist. And I won't say what type of ologist, but do what you love. But we have to back that up with better compensation for primary care doctors. Now, primary care defined as pediatrics, family medicine, internal medicine, and in some cases, OBGYN. Those four specialties tend to be the lowest paid of all. And geriatricians as well, as Jack will tell you, geriatricians are even a rarer bird. those who are specially trained to take care of seniors.
Yes. And as you look out, I'm curious, one more question around sort of the impact of COVID on attracting people to the medical profession and what you're hearing and seeing and what changes you might see there.
Well, the good news, ladies and gentlemen, is applications for all health professions programs are through the roof. I think this pandemic has really highlighted to many young people that, hey, might not be a bad idea to be a respiratory therapist or an occupational therapist or a nurse or a pharmacist, because they see what all these folks have done through this pandemic, how heroic they are, and how they can put in a 12-hour shift and go home and feel good about themselves, good about what they've done to help someone else. So we're seeing record applications for our physician program, our nursing, occupational therapy, physical therapy. It is amazing. And this is consistent around the country, that we think the pandemic have really highlighted the wonderful career that you could have as a healthcare professional, not just as a physician, but anything in healthcare now. Right. Getting a really focused look, which again is great for the country, great for New York City, and great for all of us, because all of us will likely need some sort of health care, whether it's a pharmacy visit or occupational therapy, physical therapy, or surgery, or whatever. This is good that we're going to have a strong bench and strong cadre of future healthcare professionals because of this pandemic, which again, this is one of the other silver linings to this, is the renaissance, if you will, of all the health professions.
Yeah. Well, that's very encouraging. And I just want to thank you. You are truly one of our local heroes and national heroes. And this has been a terrific conversation. So thank you for joining us. Thank you for everything you're doing. Please stay strong. And we are holding you and your teams in our thoughts. And we will really encourage everybody to follow the great guidance that you gave us. And thank you to everybody.
Sharon, I'll jump the gun here. To our donors and supporters, thank you.
Yeah, so he said it better than I could have. Thank you all for being here. We can't do what we do without you. We're so appreciative of your support. Thank you for being here on Giving Tuesday. Your dollars matter more than you can know. So thank you for being here. Thank you again to Dr. Riley. Thank you for the great questions. And we will see you all again soon.
Thanks. Be safe and happy New Year.
Yes, you too. Thank you. That was fantastic. Thank you.
Good. I enjoyed it. Thank you.
You are just the best. Really, really great. And I'll just tell. Oh, he left. I say the Bedford Splashers in the house. Thank you for being here.